A very, very warm welcome. I'm Victoria de Bourbon de Parma. I'm working at the World Benchmarking Alliance and responsible for the Food and Agriculture team. And we have worked very closely with the Workforce Nutrition Alliance. As many of the companies that are joining today, this is perhaps not your first session you are joining on Workforce Nutrition. We're very glad to see you here again. And today we will be diving more deeper into the topic, but also very importantly into the possibilities of how you can join and how you can also start to implement certain programs in your own business, or just to explore the possibilities. The Workforce Nutrition Alliance will give many interesting examples of tools that they have, from self-assessment tools to guidebooks to a technical support program. And of course, we're very happy to see such large participation today. Many of you we've seen as well during an event we organized alongside the Nutrition for Growth Summit last year. So as I said, this session will be a deep dive. We will go more into the specifics. We will also hear from Olam, from a specific case study. They are already implementing the Workforce Nutrition program across the board. So that's very impressive, and we will hear from them as well. And we are hosting today as the World Benchmarking Alliance. Of course, we've published the Food and Agriculture Benchmark last year with different topics across food systems transformation, and which is centered around three dimensional pillars. Actually, I think we can take the housekeeping rules down for now, so we can see each other's faces also perhaps. But the World Benchmarking Alliance is assessing companies on nutrition, environment, and social issues. And the nutrition pillar is really responsible for 30% of a company's total score. And one of the important indicators there is workforce nutrition. Actually, we've seen in the benchmark results last year that is only 25%, but 25%, we are quite happy that there are 25% of companies from the 350 in total that are implementing one or more workforce nutrition programs. So that's very impressive. And I think many of your companies are in that scheme of already experimenting perhaps with one program, with getting more acquainted with this very impactful topic, because all of the companies that you are representing, of course, are in direct relation with so many employees. If we look across the board, across the 350 companies that we have assessed in the benchmark, they directly employ 23.5 million people across the world. And as we are all working in the food and agriculture industry, I don't need to reiterate how important a healthy and nutritious diet is. And by giving that availability to the workforce, you can really have a catalytic impact on that individual, but usually also on a broader community, on families and communities that are affected positively. So I'm very excited about today's session. As I said, we hope to have an interactive session, but we'll first dive a bit more deeper into explaining the different ways in which workforce nutrition programs can be implemented. And we're very glad that we have two experts on this from the Workforce Nutrition Alliance. So I'm going to hand it over to Bärbel Wallingman and Mirjam Knepens. Over to you.
Thank you very much, Victoria, and a big welcome to all of you. And I was very touched to see the participants list with participation from all over the world. So we have from the whole globe is participating. So this is I'm very delighted about it, because workforce nutrition is really an essential tool that delivers proven benefits for employers and workers and farmers in their communities. And as you all know, a healthier workforce delivers better results. So the Workforce Nutrition was set up in 2019 with the Consumer Goods Forum and GAIN. And we really wanted to bring access to and knowledge about healthy nutrition to, like Victoria said, with the World Benchmarking Alliance, to 23 23 million workers and employees. So that is our dream and our vision. And why? And for you, I think we have proven benefits. So we know the major benefits, and the evidence is about, we have workforce nutrition reduces absenteeism, which is very positive. And you have fewer accidents. We could show that fewer accidents are on the workplace because of more attentive employees. And what we also see is there's a high uplift in morale. So the morale of the employees, they are more satisfied and also happier. And we see also a big change in HR related costs. So some of you are coming from HR departments, so cost decreases and productivity increases, so which is very good. And ultimately, and you will hear it from Nikhil, we want to reach the worker and the respective family, not only the worker or the employee of your company, but also the family, to really to make a contribution to the society. And we have tools for it. And I would like to hand it over now to Miriam Knepkens, my colleague from GEN, and she will guide you through what kind of tools and what journey you could go with us.
Thank you, Bärbel, and thanks everyone for joining today. It's really exciting to talk about this topic today, workforce nutrition, and how it can benefit both your company and then also your employees, as Bärbel explained. And we have by now quite some experience working with a number of companies, a wide variety actually, of implementing workforce nutrition programs, and we've really experienced the benefits over time and the wonderful solutions that companies come up with. And when we talk about workforce nutrition, we have 4 areas that you can think about. And the first one is healthy food at work. So for example, having a canteen, offering snacks during the days, having a vending machine, or even linking to local markets. There's a lot you can do as a company to help people consume healthy foods throughout the day. And as you can imagine, if you haven't eaten for a long time, for example, if you've skipped breakfast because of long commuting times and getting up way too early, having loads of responsibilities, and food is just the last thing on your list, you can imagine that energy levels and concentration levels drop. So that's a great way to intervene as a company to help people have energy and concentration for their work. And then there's breastfeeding support, where you can support young mothers to combine breastfeeding and work, which could, for example, lead to less sick leave, because children that receive breastfeeding tend to be less sick often. So there's less need for taking care of sick children. Then we have nutrition-focused health checks, where you can give people more insight in their nutrition status and what they could do about it. And of course, there's nutrition education, when we make it fun and interesting to learn about nutrition and what people could do about it. So as the Alliance, we support companies to build their own workforce nutrition programs. And there are a few elements that are really powerful when you think about what you could do as a company. So first of all, we're offering some tools to self-assess where you stand currently and what the opportunities are. So that is, I think most people in this call today probably have a responsibility to think about what the company as a whole globally could do about workforce nutrition. So it starts at that level to really set out the strategy for the company and think about enhancement targets. But at the same time, it is also really important to empower individual work sites to really think about what they could do for their specific location or factory what are the very practical solutions that they could come up with. So it's really important to empower those people on the ground and to identify what kind of support they would need. Would they work with existing partners? Do they have the knowledge in-house? Would you perhaps want to use some tools that we are offering as an alliance? And of course, we also encourage you to integrate the KPIs that are fully aligned with the World Benchmarking Alliance and with ATNI, to integrate those in existing monitoring mechanisms so that it's really easy to track progress and to report on it. And that also helps you to showcase the success for improved scores on the World Benchmarking Alliance, on ESG, and also to build an impactful story to communicate about what you're doing for employees, for the wider community, and to really showcase your company as a place where people are interested to work at. So I already mentioned it briefly, but we have a self-assessment scorecard, which is easily accessible online. And this has been used by 34 organizations covering offices around the globe in 30 different countries. And Olam, for example, has been working with us to test these scorecards in their different offices, and they are planning to roll it out in all of their work sites. So this is a very easy start to think about what are you already doing, where could you improve, what are the opportunities. And then as a next step, it might be interesting for you to look at some of the guidebooks we have on all of these 4 topics with very practical solutions of what a workforce nutrition program could look like. And then when we talk about a little bit more in-depth support to really help you think through where to start and what to do, we are offering 3 different things for different target groups, actually. So the first one is for the people who are most likely on this call. I think many of you are leading workforce nutrition or starting to think about leading that within your organization. And setting out the strategy and the vision for the global organization. So for this group specifically, we want to offer the Fast Track for Leaders, which is starting in May. And this is 2 sessions, 1 hour each, when we talk about the strategy, so setting out the strategy, all the important elements you need to keep in mind, and then also think about implementation. So how can you start implementing? How can you sort of make it practical within your organization? How can you support work sites, etc.? So that is in May, and you already see the dates listed here. And then after that, in June, we would like to offer a 1 hour webinar for specific work sites in your companies that might be interested to think through workforce nutrition, where these managers can learn about both the benefits of workforce nutrition, why would it be interesting for them, but then also what does it mean in practice? What are the costs, what are the resources they need, etc. And then thirdly, we have a support program, which is called the Workforce Nutrition Masterclass, which is a 3-month program, September, October, November this year, where we are guiding HR professionals or people in the health and well-being teams of a company who are ready to implement workforce nutrition in their specific work site. So we really help them to think through all of the practicalities of workforce nutrition, and we guide them through the whole process. And this is really nice also because it helps them, gives them the opportunity to learn from us, but also to connect with peers. And this is actually at the price of 1,495 euros per work site. So the other two elements that we offer are free of cost, but this is a paid training option. And with this Workforce Nutrition Masterclass, we are offering 3 months of hands-on technical support. You're also, worksites also become part of a global community, and they build a network of peers where they can share their struggles, their solutions, their successes as well. It's an online program where we're providing companies with a lot of resources that help them to really easily integrate workforce nutrition in their operations. And of course, we help them think through how to communicate and how to celebrate and really make, showcase the successes that they are gaining through workforce nutrition. So before I close, it might be nice to actually show you the website that we'll be sharing in the chat as well. So here under the tools and resources, you will find the scorecard where you can easily start your self-assessment and get more information, videos on it. You can find the different guidebooks here, and then also you can find more information on the masterclass. So as a takeaway, we really want to encourage you to start doing this self-assessment scorecard. Please reach out if you have any questions, and to already block your calendars for this fast track for leaders if you're interested in this. And you can sign up through email, or we'll send you the information to sign up for these specific webinars later on. So that's it from our side.
Thank you very much, Miriam, and thank you, Berbo, as well. This is really the reason why we at the World Benchmarking Alliance really love to work with the Workforce Nutrition Alliance, because there's so many practical ways to get involved, really from low, easy steps like a self-assessment tool, to the guidebooks, to even these technical support programs offering these webinars and also a more detailed course. So those are fantastic ways to get engaged. So please also have a look and pose your questions. But it's of course even more interesting to hear from an experiencer of a program, of a workforce, the implementer of a workforce nutrition program. So we're very happy today to have Nikhil Chaudhary here from the Vietnam Nuts manager of Olam Foods Ingredients. And he has been with Olam for over 5 years and is very passionate about nutrition. And he is actually responsible for the implementation of the workforce nutrition program for the nut value chain. So really you have an expert experiencer here at hand who will share his experience with us. And following that, as I said, we really encourage an interactive session. So after that intervention presentation, we will be opening up the floor for a Q&A. So please, you can already share your questions in the chat so we can address them in the Q&A afterwards. But Nikhil, a very warm welcome to you, and the floor is yours.
Thank you so much, Victoria. Thank you everyone for joining this session. I'm very happy to be here and very glad to talk about something so relevant in the modern time. I'll just quickly share my screen while we see what we're going to talk about today. I hope everyone can see my screen now. Yep.
Yes, perfect.
Yeah. So first of all, before I start, I would like to wish everyone, I think I'm a day late, but happy International Women's Day. I see that we have already passed 1 day after that, but still happy International Women's Day. It's never too late to wish. So we're going to talk about breastfeeding support at workplace, what we have done in Olam and what are our learnings, and how did we navigate through this entire implementation. Before we dive in specifically to breastfeeding, we'll also see how did we decide that breastfeeding support could be a very relevant thing to do operations and in our facilities, processing facilities. So I would just like to talk a little bit about what OFI is exactly. OFI stands for Olam Food Ingredients. So we employ about more than 23,000 employees all over the world, and our entire value chain is focused on providing food ingredients for the food manufacturers or the beverage sector. We are present almost all over the continent, all over the world, and our sourcing network is directly connected to more than 2.5 million farmers. So I think Olam, OFI in general has been very much aware of how we can possibly use sustainability in our value chains to bring the benefit to the end, end of the supply chain, which is farmers or the employees. Out of which nutrition is something very, very relevant. Why it is relevant, I'll just quickly like to navigate through the numbers. So if we just see, there are more than about 3.38 billion people working in the workforce. That's about like 45% of the world population. So we're talking about like a very big number of people that are engaged in this sector. Out of these 3.4 billion people that are working in the workforce, 40% or more are either suffering because of undernourishment or because of obesity. So we can easily see that malnutrition is something which is not only relevant in the underdeveloped area or some other areas. It's very much persistent in the workforce as well. So it calls out to all the industry, to all the corporate setups to see it as something which they should be exploring and seeing how they can possibly tackle it. So we'll be talking about breastfeeding specifically, but just to see here that the right at the grassroots level, the most basic problem that we could see is that less than the half of the infant child are exclusively have access to breastfeeding, which is quite a surprising number if we see, because right at the stage when the infant take birth, they are already malnourished. They already have a lack of nutrition. They already have the problem going on. Why do I call it as missed opportunity is because I'll be concluding it why it is a missed opportunity, and we'll see how it could be a big opportunity. But if we just quickly look at it, so there's a very big possibility of improving the productivity in the workforce, which gives a direct value to the industries. While also for the employees or for the society, as we see, most of the diseases that we see are spread because of the lack of nutrition. So it's like a very big game changer if we are able to tackle this workforce nutrition as a whole. It's quite a big difference that we can make out there. It's like just at the beginning, it's just the tip of the iceberg that we're looking at here. Once we start to do various initiatives, when we start to dig the problem deeper, we'll see that the kind of benefits it can give, not just at the micro level, but also at the macro level. It's quite big. So at OFI, we were very much aware of this, that this is something as it could be a big value. We can unlock the value in a big way, not only for us at OFI, but also for our employees, also all the stakeholders in the supply chain, and also at the community level. So so I think we were talking just about that, how scorecard, nutrition scorecard is a very essential thing. So I'll just quickly like to see how we approached this specific initiative. So we divided this entire setup into 2 steps. So we wanted to measure the problem first. We wanted to see where do we stand as of now, and then we plan on where we can navigate ourselves further. So that was the first step, which is a nutrition scorecard. We wanted to basically get inputs from all of our employees, all of the HR department, various employees at the various levels, and take a feedback, real-time feedback from them that what is working as of now and what is not working as of now. The nutrition scorecard survey that is built is very extensive, and it's very apt, if I may say, to identify what is the current status, to identify the gap, where exactly are we lacking as of now, what are the areas which our employees feel where we're lagging as of now, and then finally come up with an implementation plan, which could not only be just a plan, but it could be an action-oriented plan, because we've already recognized the gap and we already know where we stand as of now. So just to give an example, we already implemented a nutrition scorecard program in most of our work sites. We have already covered in the last year, in 2021, we have covered more than 40% of our work sites. Just to give you an example, our cashew business unit, because of the nutrition scorecard initiative, we've recognized this big gap that we could possibly use in. We have made a commitment in our sustainability project called as Cashew Trail, where we have committed that we'll be covering 100% of our workforce through various different nutrition programs by end of 2030. So that brings us to the next step, which is the implementation side. So as I just said, that through the nutrition scorecard, you can basically understand what exactly you need to do, not only for yourself, but also for your employees. So I'm just putting an example here from the Nuts Vietnam team. So I'm part of Nuts Vietnam team. I've been working with Nuts in Nuts Vietnam for more than 5 years, working with various processing units, working with all the employees that we have. And once we recognized nutrition scorecard as an activity to basically set ourselves in the position to see what exactly we need to do, we could see that this specific activity of breastfeeding awareness is very much relevant to us. So just to give a snapshot of why it is even more relevant to us, is because we have about 3,500 employees in our various work sites. We have about 12 processing units in Vietnam for nuts processing, out of which 70% are women employees. So it gets even more relevant to us, because we need to cater to all the needs and to the requirements of those employees. But overall, if you look at the numbers, you'll see that while the world average is less than the half of the infants are exclusively breastfed in the age of between 0 to 6 months, in Vietnam it is even worse. It is only 24% as per UNICEF's research, which is almost half in the world average. So I think this was something that we recognize as something very, very much relevant in Vietnam specifically, and even more so for our business and our employees that we have in our 12 processing units. So once we recognized that we would like to take breastfeeding support as one of the initiatives, as one of the focus pillar in 2021, the first thing that we wanted to do is go ahead and provide the basic infrastructure in all of these processing units. So we call it as maternal care rooms. Each of the factory have access to, I think we can see here, the milk pump, the storage place, a separate room, a secluded room for the employees to access any point in time, and store the milk for they could use it when they go back home later. But I think it's not where it ends. I think it's a lot of awareness, a lot of training, a lot of counseling that it needs. It's just not by providing infrastructure we could possibly bring a change. It's a lot to do with how people perceive this specific thing. And moreover, a lot of training needs to be given to all the employees so that we could effectively bring use for this infrastructure. So as a very first step, what we have done is we have provided infrastructure of this lactation room in all of our factories and all of our processing units, where they have access to not only to the milk pump, but also to the various supplements. Also, when they have any doubt or they have any anything that they would like to ask about, we connect them with the experts to get the awareness. But we wanted to do it in full swing, having a daily access to the subject matter experts. So this year on, we'll be partnering with Alive and Thrive. They have quite a good presence in Vietnam. They've done various work with the government and also with the private sector previously. So we'll be partnering with Alive and Thrive, and this year we'll be looking to focus on each and every employee on day-to-day basis and see how we could possibly bring in more and a bigger change by the end of this year. So these are some of the photographs from the lactation room that we have in our processing facilities. So there are some basic training programs, the basic training material that they've given in each of these rooms, a comfortable space for them to sit and feel comfortable to use the equipments, store it in a freezer so that they could use it later when they go back home. So while we are implementing all this, it's very obvious that there will be some challenges that we need to tackle, and we need to manage those challenges. So we had our share of challenges. What I'm sharing is quite a snapshot of the complete journey that we went through. And from me, I think if we are able to focus and we are possibly able to find out solution to these three primary challenges, I think we're good to have a good project implemented. So the first challenge that anyone could possibly see is that aligning their team, that why workforce nutrition is something very important. I think aligning your stakeholders, not only for the current project initiation, but also for what kind of value would you like to unlock going forward in next 1 year or next 5 years. I think that kind of alignment and that kind of visibility is very, very important so that you have adequate support and resources for managing the project. And it is not only applicable to the breastfeeding support, or like it could be possibly be very much relevant to all the workforce nutrition projects that we're trying to do. Second is that while we do have a lot of commitments and a lot of goals that we make for ourselves at the start of the project, but I think that's just a very small part of a successful project. I think having a very clear implementation plan, what is possible to do and what is not possible to do, that kind of distinction can only help us proceed ahead in a very good manner. I think once we are clear with all those things, I think the industry does not have that kind of expertise to implement the project in a quality manner. Like, I think it's easier to implement anything, but if the quality of the implementation is not good, it's not going to benefit in the long term. So I think partnering with the relevant subject matter experts, partnering with it could be possibly some consultants or some NGOs, or it could be any organization, it could be hospitals nearby. But having the subject matter expertise at our end is quite necessary for quality implementation. So that takes us to the learning and scaling. Since we know that the nutrition scorecard is like not like a just one-time process; it's a continuous process. We need to do it over and over again. We need to see and recognize how much progress we have made after a fixed interval of times, and then taking all the relevant learnings and see what better we can do. So for our journey of last 1 year, there are few very basic learnings and scaling that we have seen, and I think I'd just like to sum it up in one single line, that is, it's a win-win for everyone involved in the value chain. It's a win for organization, and these are not the only numbers that you should be looking at. Like it's even beyond that there are possibly much more and bigger value that you could generate out of it. But I think these are the very basic stats that you can possibly look at just to see how the project is bringing and unlocking value for everyone. So for the organization, it's a very obvious improvement could be in the improved productivity, reduced expenses on the health-related, employee health-related expenses, insurance-related expenses. And also, there could be a very big and a very good engagement that you can create with your employees. I think it's more like getting to know all the core issues that the employee might face from day-to-day basis in their personal life and in their family life. And I think if you're able to engage with an employee at that kind of level, it really creates a good, creates a good rapport between the organization and the employee. On the employee side, they have improved health outcomes. They see fewer sick leaves, their income is improved, their expenses on personal healthcare reduces as well. So they end up saving more money. Also on the side of society, if we see, I think there are quite a number of stats that are possibly available, but I think if we just look at the macro level of all the small activities that we're trying to do here, I think I'm sure of it because we've implemented in the last 1 year, but I think it could bring in a very big tangible impact in the GDP. Which could be in terms of healthcare expenditures of a country, which could be because of productivity, which could be because of education. So it is a multidimensional benefit that you can bring in for the society as well. So I think this is a snapshot of very brief on how we've implemented workforce nutrition project in our sites in Vietnam. To start with the nutrition scorecard as setting the benchmark right, and then moving ahead and implementing relevant projects. Thank you so much.
Thank you to all the speakers for their input and again really these really practical and very useful tips. I hope you had a very good session. You can understand that WBA is really thrilled to be working with the Workforce Nutrition Alliance because they're a very strong technical partner to help companies improve in this field of workforce nutrition and the different ways in which you can implement that across your organization. Of course, the WBA is convening these types of community of practice sessions, so peer-to-peer learnings, because we really want to amplify these leading practices that we've seen from Olam and also that was shared that Indofoods is also on its way for implementation. Because the WBA is that's why we are an alliance. We work with partners who take the next steps. We are the neutral assessors and we benchmark companies, and then we really look at the catalytic topics that are ready and mature enough to get into this next stage. So I'm really hoping that you were very incentivized today by all the energy and opportunity that workforce nutrition provides, and with the vast variety of tools and resources you can find on the Workforce Nutrition website, and indeed starting with the scorecard. I think that's a really good low-hanging fruit for every company. You can just fill it out yourself and see where there would be a possibility for your organization to improve. And thank you, Jessica, for your comments. Please make sure to read them about Indofoods' take on implementing and being part of such a technical support program. So as it was said, there will be, for the companies that are part of the World Benchmarking Alliance assessment, there will be these different sessions available, webinars and really availability to dive into the step-by-step approach that you can take for implementation, and followed up by a longer technical support program once you're really ready and have a specific idea for your organization. So feel free to reach out to the energetic, great team of the Workforce Nutrition Alliance. You can also reach out to WBA. We will forward your request request, but wishing you that you've really been inspired today, and we'll get in touch with this great team to help you further. And most of all, I think as Nikhil really touched me, as you know, coming from a business perspective, to speak about employees looking further in the value chain, but as a business also to really see the power of the impact that this can have, not just on the employees, not just on the direct individual, but as you said, on their families, on their communities, and so on really our society at large. So thank you very much for those inspiring words, and that is really the force of nutrition, really letting us be strong and healthy and productive for our communities and society. So I wish you a great day, and I'm looking forward to seeing your responses and requests coming in. Thank you very much.